Good evening, everyone. So excited to join this illustrious panel and certainly really excited to join Congresswoman Kelly. Thank you very much for convening all of us together. We're excited that everyone who's joining us in the audience is present. We hope that your families are okay. Mostly we expect that there are people across Chicagoland who are joining us. In case you have family or you yourself are elsewhere, and particularly in Texas, we certainly extend our heart to you and send you warmth and send you good vibes and hope that you and your family are staying safe. And without further ado, we're going to be talking about other life-saving significant issues today, primarily the safety around taking the COVID-19 vaccine and answer any questions that you might have. So feel free, if you do have questions as we're talking, to drop them into your chat. We'll be fielding them. Otherwise, we have with us some really phenomenal people. But first, I want to just give a very firm and heartwarming welcome to someone who's near and dear to my heart, both on a personal as well as a professional realm. My old boss, not old as in age, because no one will guess how old this woman is. I know how old she is, but no one else is going to guess. But we really appreciate Congresswoman Robin Kelly, who represents the 2nd District of Illinois, as just an avid public health servant, and policy expert. She's here today to just talk to us in her various capacities. And she has just a litany of service orientation that follows her. And I'll just mention a couple that she maintains to this day as a member of Congress. She is the member of the foremost leading policy body particularly around health issues in the U.S. House of Representatives. She's a member of the House Energy and Commerce Committee, where she serves on the Health, Energy, and Consumer Protection and Commerce subcommittees. And her work there, she focuses on expanding access to healthcare. She focuses on consumer protection for American families, and certainly with respect to both physical as well as economic development. She also serves on the House Committee of Oversight and Reform, where she is able to really raise issues around civil rights and national security and civil liberties. She represents overall the Midwest region in terms of the House Dems and the Steering Committee and Policy, where she sets the direction of the Democratic Caucus as a member of the House Democracy Partnership as well. She's also a co-chair of the Congressional Caucus on Black Women and Girls. She does a lot of work on the Gun Violence and Prevention Task Force, also as a co-chair. She's the author of the first ever Kelly Report on gun violence in America. It's the first ever congressional report on such an issue. And just on and on and on. The woman does it all. She does sleep, I promise, a little bit, although I try to get on her about that. But Congresswoman Kelly, don't let me brag on you anymore, but I'm so appreciative of the work that you do. I'm going to hand it over to you so you can tell us a bit more about what's going on today and what we should expect.
Well, thank you, Mia, my forever staff person, for that wonderful introduction, and welcome to all the panelists. I thank you so much for taking the time with us this evening, and thank you to everyone listening and everyone who will listen, because they will be able to listen after this is taped also. Good evening. I am Congresswoman Robin Kelly, and I have the honor of representing the 2nd Congressional District of Illinois, and my district extends from the tip of Hyde Park through the southeast side of Chicago, extending into the south suburbs and further south to Kankakee. As Vice Chair of the Energy and Commerce Committee and Chair of the Congressional Black Caucus Health Brain Trust, I work with my colleagues to address the glaring racial inequities in healthcare. I'm so glad that you could join me in our highly esteemed panel for my COVID-19 town hall on vaccine safety and benefits. We've been battling COVID-19, the pandemic, for nearly a year now, and it's been a trying time for all of us. Like many of you watching this event, I too have been impacted by COVID-19. I've lost a couple of family members to this disease last year. So far, over 27 million Americans have been diagnosed with COVID-19, and nearly 500,000 Americans have died from this disease. Despite those staggering statistics, we're starting to see a glimmer of hope. We now have 2 FDA-approved COVID-19 vaccines being administered, with several additional vaccines being tested and reviewed for safety and efficacy. As you may know, I've received both doses of the Pfizer vaccine. I've had no after effects, and I'm feeling fine. And I'm a chicken, and it didn't even hurt. So I really want to ensure you that my constituents, I want you to have factual information so that you can make informed decisions on whether to take the vaccine or not. I know that many in our communities have trust issues and hesitancy toward the vaccine, but I believe that when you hear the facts, you will want to receive this vaccine. In fact, we did a little survey from our office and got about 400 returns. And I'm happy to say that most people, about 75%, said they would take the vaccine. They just have a hard time signing up and getting the vaccine. But for those who are still hesitant, they talk about they've never taken a flu shot or they don't take the flu shot. Another 78 of those that don't want to take it talk about the fear of trust, but they did say that they trust their doctor, and like we all do, they trust Dr. Fauci. And for them to take the vaccine, they just want more information on long-term effects and safety data. So for our panelists, those are just some good things to know. So for the next hour, we'll have national and local health experts help educate us about COVID-19, the importance of taking the vaccine, and where you can get the vaccine. And before I turn it back over to our wonderful moderator, Mia Keys, I just wanted to say one more thing. We have gotten so many phone calls about the issues going on with the post office. I just want you to know that I'm aware of what's going on. I've been affected like so many of you, and the Illinois delegation is working together. We've sent a letter to President Biden, and I'm also on the oversight committee, as Mia has talked about. So the post office is under us. We've had hearings of the last Congress, and we will have more hearings. And there are many letters going to the president. One thing that he will have to do quickly is replace the people on the post office board. And when he does that, then they can get rid of the leadership that the former administration picked, which made some changes and slowed up mail and those kind of things. And I know the post office in the Chicagoland area, they will be hiring more people soon. And then the other thing, just to help them, the weather has not helped them. So as much as we can even clear our paths so they can deliver more mail or as much mail as possible, that would be great too. So I just wanted you to know, I hear you, and we are taking action to hopefully in the near future, speed up the mail. So thank you. So after that, or right now, I'll turn it over to our moderator, Mia Keys, and thank you so much for agreeing to be the moderator. Thank you so much.
Anything for you, Congresswoman, for sure. And I appreciate also your mention of the post office, particularly from a medical standpoint, we rely on post delivery of really very critical medicines and drugs and such like that. And so that is relevant also to today's conversation. So I appreciate you offering that. I also failed to mention that I used to work for the Congresswoman, but currently I work for the American Medical Association as the Center for Health Equity Director of Health Equity Policy and Advocacy. And I couldn't have been able to really think about the equitable bend had it not been for my time under the Congresswoman's tutelage. And so I appreciate everything that you've done, Congresswoman, and the ways that you continue to teach. And also your network. You have such a strong network, which is clearly visible to us here with our illustrious panel, who I just can't wait to dig into in terms of you all helping us today to think through some of the issues around COVID-19 and especially with respect to the vaccines, distribution, concerns, as the Congresswoman mentioned, around trustworthiness of institutions and so on and so forth. And so without further ado, I'd like to just introduce our panel. So first and foremost, or at least in terms of across my screen, we have with us Dr. Gary Gibbons, who joins us as the director of the National Heart, Lung, and Blood Institute at the National Institutes of Health. And we really appreciate you being here with us today, Dr. Gibbons. We look forward to you helping us to understand NIH's role. We've been hearing a lot about other federal institutions across the pandemic's existence. And so it's really significant today that we can talk through why the NIH is so significant to this conversation and to the health of those who are benefiting from the vaccine. We also have with us Dr. Angel Lee. Thank you very much, Dr. Lee, for joining us. She joins us today as an infectious disease specialist. And of course, it goes without saying, we cannot have a conversation about COVID-19 without talking with someone who's able to walk us expertly through the significance of infection and why the COVID-19 vaccine is so very unique compared to other infectious diseases. We also have with us a longtime colleague and ally of Congresswoman Kelly's office, Dr. Cheryl Rucker Whitaker, who by training is an internist. She joins us today in her capacity as CEO of Complete Care Management Partners, LLC, out of Chicago. And so we're really excited for you to be here. Thank you very much, Dr. Rucker Whitaker, for joining. And last but certainly not least, to help bring us more into a local perspective, we have with us Dr. Amal Tokars, who is a really mid-year, mid-pandemic hire as assistant director of the Illinois Department of Public Health. And to come in and to do that work at such a high stakes time, it goes without saying just how much of an addition you have been to that office. And we look forward to hearing from you, Dr. Tokars. Thank you. So I want to just give you all time to briefly tell us a little bit about yourself, your current work, your background, and why that's relevant. So if you could just take about 90 seconds or so between all four of you to give us a little bit of that. We'll start with you, please, Dr. Gibbons. You're on mute there, sir. You're saying all the good things. It's all good.
After being on Zoom calls all day, you think we pick it up. It's a long day, but it's my pleasure to be here, particularly at the request of Congresswoman Kelly. I'm the director of the National Heart, Lung, and Blood Institute, part of the National Institutes of Health, largest biomedical research agency in the world, and it's been directed by Dr. Francis Collins. You're all familiar with our colleague and friend, Tony Fauci, and our institute has been involved in the NIH response to the COVID-19 pandemic. Clearly, a key part of our mission is discovery science, and discovery science is really the bedrock of developing new drugs and therapeutics and vaccines to address, treat, prevent, and eventually crush this pandemic. And so therefore, the entire apparatus of our research enterprise has been focused on developing the effective treatments and therapeutics in this space over the last year. In addition, I've been charged to lead an NIH response called the SEAL program, the Community Engaged Alliance Against COVID-19 Disparities, that was developed in response to addressing the clear inequities that were laid bare by this pandemic and this virus, and developing a community engaged response, particularly in communities of color, that address those disparities. And so that's where I'm delighted to be here. Clearly, as a cardiologist and non-infectious disease expert, we recognize this virus affects the lung, the heart, the blood systems, and that's part of our portfolio, and that's why we're playing a key role. Thank you.
Thank you very much, Dr. Gibbons. That was really quite vivid, and it helps to level set our conversation. I want to hear from Dr. Leek. Dr. Leek, tell us a bit more about your work and as an infectious disease specialist and what you're able to help us to consider today.
Well, as an infectious diseases specialist, my biggest goal right now is really more of a grassroots effort. It is to educate. It is to make sure that peoples of color, especially the brown and Black communities and disenfranchised communities, understand what this disease is doing within its communities and addressing any issues, any barriers, breaking through any obstacles that prevent them from receiving the proper medical care and making sure that they get the vaccine.
Thank you, Dr. Leek. Dr. Rucker Whitaker.
Thank you, Mia. I'm an internist, and actually I spend most of my time now as a CEO of Complete Care Partners, Management Partners, LLC. We do work in the community for health plans who are looking to find the highest risk folks and get them connected to care. So we're building into our work, although it's not required, kind of a COVID-19 kind of question, a wellness question or two, and we're helping our members try to figure out when they can get vaccinated and where they can go. One of the biggest things that I'm finding is that people want the vaccine, but they don't know where to go. So it sounds like the city of Chicago and the state and the county are rolling out various sites, but no one knows where they are. And maybe that's intentional. They're going after sort of micro sets of people, but I know lots of people who want the vaccine. So I'm very encouraged that the problem I'm seeing right now is that there's not enough vaccine, number one. Number two, if there is vaccine out there, people don't know where to go. They really want to go. I'll give you an example. 69th and King Drive on Saturday, I got a text at 2:30. Hey, they got a few doses left. You get here by 4 o'clock, you can get a dose. Well, everybody I knew, people were like, well, I can't get over there as fast enough, but one guy did. He's in his late 50s. He's living with one chronic condition, a retired Chicago police person. He got over there and got his vaccine. So I got one person in, but it was more like a, hey, it's over here. And so people is sort of like, where's Waldo right now in our community? Because we're using the CVS and Walgreens as a major distributions point, but many of those closed in our community. So if that's going to be a key place, we're going to miss opportunities to be vaccinated. So what I'm looking for is more equity in distribution sites, and so that people have more opportunity to get the vaccine and more communication about where the vaccine is. So just excited that my biggest issue is finding enough vaccine. That's a good problem.
And we're going to dig into that good problem. Thank you for that, Dr. Rucker-Whitaker. And Dr. Tokars, who's joined us here on the phone today. We appreciate you.
Oh, you're so welcome. So can you hear me clearly?
Very.
We sure can.
Okay. So as you mentioned, I came to the state health department just this summer in the pandemic. I am not a physician. I am a public health professional. And prior to that, I was leading county public health policy and infrastructure building in public health for a number of years. My clinical background is in mental health, and so I am often thinking about the intersection between the kind of duress that this disease has brought to our society and the many other kinds of duress that the pandemic has brought as well. So these are things that I pay attention to a lot. I also am always very interested in the way that we build our civil society together as one that would nurture for all, which is alluded to in a number of ways in this conversation thus far. And so everything that we do can work towards that if that is our intention. So I'll close there. I know we have a lot to do this evening.
I'm so glad and grateful that you mentioned the mental health and behavioral health part. We're going to make sure to come back to that, especially because we know that you're with us for a limited time. So if for whatever reason I do not ping you to talk about that, please insert that into somewhere into your remarks. But I want to just back up a little and just go back to you, Dr. Gibbons. And you know, I don't want to assume that everyone listening knows the intricacies of COVID-19 in terms of what the virus is, how it got to pandemic proportions. So I'm wondering if you can give us a bit of that and then segue into what the vaccine does, what it is, and how it was developed.
Okay. I'll start off. Maybe Dr. Leek will add in, but this is a virus, a particular kind of a novel coronavirus that is spread basically in the small sort of tiny droplets that are expelled every time we speak or sing. And that's how it spreads from person to person. And it can attack the lungs, the heart, the blood systems, and the various major organs and produce a devastating, particularly pneumonia, that then can spread and affect multiple organs to the point of failure, where your kidneys shut down, your heart can stop pumping, you need a ventilator to help you breathe. And so the severe complications of COVID-19 are devastating, and that's why it's probably at least tenfold more virulent and deadly than a flu. So to speak plainly to your audience, this is no virus to play with. It has devastating consequences, and it's hit the communities of color in a devastating way, with higher case rates 2 to 3-fold, higher hospitalizations, again 3 to 4-fold in communities of color, and unfortunately death rates. In fact, the life expectancy of Black Americans dropped by 3 years in 2020. That's how devastating this has been for communities of color. So this is a virus that is having a global impact and particularly disproportionately affecting communities of color, African American, Latino, American Indians in particular. The best ways to fight this virus is to prevent it from coming in and infecting our bodies. The best way that's done is through vaccines. Vaccines work by training your body's own defense system, its immune system, to really fight the virus. This is a new virus, and so most people had not been exposed before, and so our body's defenses were not that buttressed and strong to defeat it, particularly amongst our elderly. And that's where it's been so devastating in fatality for elderly people who've never seen this virus before. So the vaccine, the treatment, in essence, exposes our body's immune system, kind of teaches it, trains it to recognize the virus. And so vaccines work by taking a piece of the virus and exposing it to the immune system. If you will, this coronavirus, it's called that because it has these spikes, almost like a crown, like a king. And those proteins on the spike proteins are what the vaccines have developed. It's only a part of the virus, not the whole virus, just a part of the virus. And the vaccine, by exposing the body to that piece of the virus, trains the virus trains the body to recognize the virus and destroy it, eliminate it from the body. That's how the vaccines protect us from developing symptomatic COVID and certainly preventing hospitalizations, death, and mild to moderate COVID. So all the trials that have been done throughout the world involving tens of thousands of people participating in those trials have proven that if you get vaccinated, you then teach your immune system to fight off the virus, ward it off. Those people are much less likely to develop COVID and require and get sick at all, and up to between 70 to up to 95% effective, and in a very safe way. And so really, vaccines are a critical part of crushing this pandemic. I'll pause there.
That is so helpful for helping us to set. I want to go to Dr. Leek for a follow-up question with respect to the technology of the vaccines, but I know we're also going to be losing Dr. Tokarz in just a little bit, so I just want to pivot a little bit. But Dr. Leek, I'm going to come back to you to expound on what Dr. Gibbons has mentioned. Dr. Tokarz, so you've just come in during the height of the pandemic, really, and so there's a lot that you've seen with respect to who's being impacted, and then now there's a lot that you're preparing for in terms of the rollout of the vaccine. I'm wondering, can you talk to us about who's able to get vaccinated currently in Illinois, especially given who Dr. Gibbons has mentioned is the most vulnerable among us?
Yes, I'll say briefly that that's one of the most important questions that people often ask about. So the individuals that are eligible are, first of all our medical professionals and all persons that are residing in nursing homes along with the staff that work there. Now in Illinois, we also decided early on, because we had many vulnerable populations in other kinds of congregate care and residential programming that with severe disability, many different kinds of disability. So we also included all of those precious persons and the staff that work with them. Also, the Advisory Committee on Immunization Practices has cited a number of frontline, very specific professions. We have aligned with that, and we have not added or taken away of any of those that are in 1B. What we have done is we have looked at the age. So the age originally was going to be 75. We, in December, early on, looked at the age of 65 and older, because when we looked specifically at who passed on because of COVID in Illinois and what ages they died and what race they were, this is what we saw. We saw that many Latino persons were passing on from COVID in their 60s, and many Black persons were passing on from COVID in their 70s. So as it was mentioned previously by one of my colleagues, that elders were the most likely to have an adverse outcome from COVID and pass on. Not only did we want to address our elders, but also address those racial disparities that we saw within that. Also, we wanted to add persons that are experiencing homelessness or are in a shelter, any kind of a shelter or day program or sheltered workshop or psychosocial rehab. We wanted to make sure that those persons were also getting vaccinated early. There are also a number of medical conditions associated in the literature and mentioned as definitely associated with adverse outcome by our ACIP committee. So those medical conditions are also going to be eligible starting on the 25th to be able to apply at slots at pharmacy, along with persons with disability that are not already covered. But this is also what I want to say, and this is one of the most important things to say. There is a limited supply. I say that out of consideration and reverence so that people don't have fear when they're looking, and they will know that this infrastructure is there. We have these providers that are ready, and it's nobody's fault. Our federal partners are giving us the vaccine not late. They're giving it to us as soon as it's prepared. And these vaccines are being prepared in the time that is proper for them to be safely prepared. So we are getting the vaccine as quickly as is reasonably possible, and every state is doing this. And so people will have to look for an opening more than once, and our federal partners are telling us that we will be getting more vaccine, and we believe that to be true. So we've got beautiful partners in the community all over Illinois doing a wonderful job. We are moving vaccine quite quickly as we get it, but we are really limited in our supply, and I think that's very important to say. And related to mental health, communicating crisply and clearly that the supply is limited now, but we expect there to be more, is very, very helpful so that people don't believe that they are getting left out, and know that there will be enough for all of us, and that when our turn comes, we want everybody to say yes and step forward for that vaccine. As the Congresswoman has said, she went through that and she is feeling just fine now. And you will all know people that received the vaccine and are doing well. Ask them about it so that when your turn comes, you will say yes as well. So I know I have to close with that, and I have to leave momentarily in just a moment. I hope I answered that question for you well.
You really did, and I appreciate you offering the answer at intersectional junctures. You talked about vulnerability in terms of age, in terms of race, ethnicity. Can you talk to us before you leave a little bit about what people living in rural areas, downstate Illinois, on the countryside, what are some considerations for them in terms of accessing the vaccine and some challenges that they might face right now, and how can we be helpful in helping them think through navigating all of that?
Okay. The largest challenge that everybody faces is limited supply, and that really affects their ability to get into a clinic and find a clinic. So the first thing that I want to say is, if you look on our website, most people are finding out locally, but I think it's also helpful to look at, we have a website that says coronavirus.illinois.gov. And on that website, there are all the sites of providers. There is all the information on eligibility. There is a lot of data, because we also want people to pay attention to still protecting themselves from COVID. There's so much more to do that we will need to continue to do to keep safe public health practices to protect ourselves from COVID. And there's also a lot of information about testing, which is also still very important. But on a map where it gives locations, there's like a red teardrop, and these teardrops will point to the precise address of a current provider, not a future provider, because there will be more future providers, but these are current providers. So individuals can look in their own vicinity, and then they can call that provider or get on that provider's website. Now, you will see a concentration of teardrops in suburban Cook, a concentration of teardrops in the East St. Louis area, and also in the southern tip of Illinois, because these are areas that individuals have not been able to always access equitable, quality health care for all kinds of things. So we really want to make sure that there is plenty of access. We are speaking to providers about a number of things to help make things easier for individuals. First, there is a digital divide, and even though it's so wonderful that providers are having people register from the comfort of their living room and have that secure spot for themselves so they can go calmly and safely to their vaccination appointment, we also need people to be able to, when they do not have a computer or do not have a smartphone, be able to call and be able to do it that way. So we're also talking with providers about that. There are also lots of difficulty for individuals that have a difficult time just walking across parking lots for a number of reasons. And so there are a number of providers that are also providing drive-up options, which will be very important for individuals. We also are doing quite a bit of engagement at local churches, for local groups that ask us, but we are also initiating this engagement for groups to hear about what they need and helping them access in their very specific circumstances. We also have mobile units that we are able to deploy to help in some of our rural areas. And we have also stood up the National Guard in some of these areas to really help assist in providing vaccine on large scale to individuals. So those are a few things. There is so much more to do. But we are very pleased with the progress that our partners are making thus far.
I really appreciate all of that.
You're welcome. I have to close with that, but I so appreciate being with you, and feel free to reach back to me if you need to again.
Thank you, Dr. Tokars. And just to reiterate for the audience, the website that she mentioned is coronavirus.illinois.gov. And hopefully we can link that in the chat feature so that you all can take a look at that. I want to go back to you, Dr. Leek, and Dr. Gibbons, feel free to jump in here. Talk to us about, you were telling us a bit about how the virus itself is set up and therefore how the vaccine matches onto the virus, the technology associated with all of that. Dr. Leek, can you expound a little and tell us, the difference between the foremost leading vaccines available right now, the Pfizer vaccine, the Mrna vaccine, and do people have a choice in terms of taking which one?
Okay, first I'm going to go back just a little bit and talk about the mRNA vaccine. This technology is not new. So because because of the pandemic and because it is the worldwide, mass destruction it's caused, we're thinking like, oh, this is a new thing. No, it's not. We've seen this before. We've seen it with MERS. We've seen it with SARS. And so at that time, more than 10 years ago, they started creating this technology to actually answer those issues with MERS and SARS. Now, because it kind of fell off a little bit and not everybody died, kind of just lost interest in formulating it because it takes a lot of money to develop these vaccines. mRNA vaccine, basically, it's just the instructions to our cells to create a spike protein that is very similar to our SARS-CoV-2 vaccine. Or not the vaccine, the actual, the virus itself. And so when you have that and you develop proteins to it, your body now sees that and then develops antibodies to that mRNA piece there. So when we look at the Pfizer vaccine and we look at the Mrna vaccine, they are very similar. They're very similar because they both use the mRNA technology. And with the Pfizer being able to be taken, and then the secondary one being taken 21 days after, and the Mrna one with 28 days after. So once you have this mRNA technology that then starts to create an antibody response, the reason why you take the first shot, because it basically primes your antibody, it primes your immune system. And so at that point, you get about 50% coverage. Now, when you go back 21 days later and 28 days later, respectively, with the Pfizer and the Mrna vaccine, it will then reach up to 95% for both of those vaccines. We see some coming down the pipeline, if I could just take this moment, that everybody is excited about. AstraZeneca has one coming down the pipeline, and Johnson & Johnson has one. Now, these two are using different, shall I say, directions. Their Uber systems are different. They use an adenovirus. And so, again, just like with the mRNA vaccines, they are not using any live vaccine. So nowhere at any moment in time is anybody who's receiving the vaccine receiving any live vaccine. And therefore, it should not give you the response as I'm getting sick from coronavirus. The interesting thing we're getting excited about with Johnson & Johnson is because it's a one-shot vaccine. And when you look at the AstraZeneca and the Johnson & Johnson one, it's really a lot has to do with how we are trying to store them. Our Pfizer vaccine has to be ultra refrigerated or ultra freezed. And then you have the Mrna, which still has to be held at very, very cold temperatures. So how do we handle our patients who are in the rural areas? Let's talk about the Appalachians. Let's talk about the Mississippi Delta. Let's talk about any rural areas of Arizona. How do we try to, number one, deliver these vaccines to those places? It would make it very hard to deliver the Pfizer and the Mrna to those areas. So even though Johnson & Johnson has a 70–75% coverage, the fact is it's a one-time vaccine, and then their shelf life lasts a lot longer than the other ones that we have now.
And that is particularly relevant to the Congresswoman's district, which she says all the time is urban, suburban, and rural, right? And so those rural areas in particular, for those of you who are listening and you live, downstate, I hope that you're hearing beyond all the big words, the mRNA and antivirus and all of that. And what Dr. Leek is saying is that there are developments coming down the pike that are really top of the line, state of the art, and they're specifically designed to cover everyone who's eligible and able to take the vaccine. And some will work better in certain situations. So we're grateful for you breaking that down for us, Dr. Leek. I'm wondering, and I'm going to wrap back around to you in just a little bit, Dr. Gibbons, but Dr. Rucker-Whitaker, so Dr. Tokars was talking to us about those who are particularly vulnerable to contracting COVID-19, and as an internist, you've seen quite a lot. And you mentioned earlier, issues that people have with just trying to consider access, to the vaccine itself. But back up and talk to us a little bit about those who have had COVID, your experience with COVID-19 patients. What does it mean for people on both extremes, those who are really very vulnerable and they become sick and they're sick for a long time? What does it mean for them to be considering getting the vaccine? And those who are healthy and never become sick and all of that, what should they be considered? Should they consider getting the vaccine? Can you help us think through that? And you're on mute there.
There you go. So my recommendation, I'm with kind of a lot of the national recommendations, really everyone should consider getting the vaccine, unless they're known to be allergic to some component of the vaccine, right? So that's really, as far as I know, Dr. Leek and Dr. Gibbons, the only exclusion criteria that I've seen. If you had COVID, I heard, the latest I heard was that there's there's about 6 months of protection, if you will, antibodies there, but I don't know how much we actually really super know about that topic. So I'm recommending folks, whether you've had COVID or not, if you had COVID, you should get the vaccine. And so many folks I know have gotten the vaccine who they've had COVID. and they've gotten the vaccine with no problem. So the vaccine confers what I call sort of known immunity. We kind of know what's going on in the body. We're really just learning, and we're following and tracking folks. So what I tell people who say, well, I'm well and I've done well, I haven't gotten COVID, I don't need the vaccine. Oh, and plus I don't know a whole lot about this vaccine. You know, what do we know? And I think Dr. Gibbons, both Dr. Leek and Gibbons pointed out that really over 75,000 people worldwide engaged in the trials to determine that this vaccine was safe. We knew it was efficacious. We knew it worked, but then was it safe? And we spent, there's been thousands of people that have been involved in the trials, and those people are doing well. So we're still learning from those people, and that will be ongoing, right? We will be checking on them for the foreseeable future to understand, you know, how much antibody is present and for how long. So just know that all of that is being kind of studied carefully. And when we say study, this just a scientific term, means we're monitoring and we're watching. So you're not being studied, right? You're being monitored appropriately and watched as you would with most things. So I tell people, whether you've had COVID, you didn't have COVID, you should get the vaccine. I think Dr. Gibbons pointed out, there's a real difference in the mortality between the flu and COVID-19. 50,000 people or so die a year from the flu. Over 500,000 have died, and we're not barely a year into the epidemic. So it's like a very high fatality factor, like 10 times what we know about the flu. And there's probably even more people who've died. So I try to remind people that this is not just a flu. I don't get a flu shot. Okay, don't get the flu shot. Wait, don't quote me on that. Okay, I'm saying, you know, I'm not getting the flu shot. I'm like, okay, but get the COVID-19 vaccine. I did have the vaccine. I did experience a little bit of side effect. I had some shaking chills. I had a bit of a headache the next morning, and I had felt fatigued. I took a couple of ibuprofen. I laid back down, took a nap. And when I woke up in the early afternoon after I got out of bed, I was fine. I'm ready to get number 2, baby. So I'm ready. And I want to encourage everyone that this is the difference between really life and death, and getting back to some kind of normalcy as you know it, right? So I go to a large church. I told folks, I said, look, you will never have Trinity Church again, because if 2,000 people show up and 50% of them aren't immunized, we're having a super spreader event every Sunday, right? So we want anything that we used to have where we gather together. It's a big part of returning to that normalcy, Mia. So I tell everyone to get it. I'm a big fan of the vaccine.
Looks like Dr. Leek wanted to mention something.
I wanted to add on to that. I had a lot of patients initially who fought me on that idea. They said, oh, I already had the COVID. I have immunity to it. I'm good. I should be good. And I try to give them the analogy of such where, and I think all of us, especially colors, communities of Black and Brown understand back in the day, and when we would have chickenpox parties. I don't know if you guys remember that, but remember when you always had a cousin who got chickenpox and someone else got chickenpox, you went over their house because your family wanted you to expose yourself to it so you would develop basically antibodies so that when you got hit with the chickenpox, you'd be okay. But what did we find out? Even though you're with the family members that had chickenpox, later on the line, you got it again and wondered why. Because you really didn't develop much of an immunity to it, even though you had that first initial exposure. So simply, that's very similar to the COVID exposure we're having. Some of those people who are asymptomatic and those who get it lightly and feel kind of achy and they stay at home, yes, you've been exposed to it, but we don't know the level of immunity that you have built in your system. And so just like that with the chickenpox exposures, when we started having varicella vaccines, what happened? We started seeing less because we're able to get enough of a collective immunity up, and we no longer see it. So likewise, that's what we're trying to attempt here with the COVID vaccine. We're trying to get enough of a collective immunity, what we call a herd immunity, which is what we've identified to be over 70%, to kind of downward trend what we see right now in terms of COVID exposures and infections.
Rapid fire questions for you, Dr. Leek, before I bring in Dr. Gibbons here. If, to your point about being vaccinated, do you continue to social distance and wear a mask?
Oh, absolutely. There was actually, I think there was a representative from Massachusetts. He was vaccinated, got both of them. Now, I don't know the time frame after the second one, but he received the second vaccination and he tested positive. He had no symptoms whatsoever, but what ends up happening? He ends up going to another party, to another event, to another meeting, and he's just spreading COVID without even knowing it. He's fine, but everybody else is getting sick because they don't have any vaccinations.
I hope you all heard that clearly. Even if you've been vaccinated, it doesn't mean that we stop the public health hygiene. You keep up with the mask, keep up with the social distancing, because you can still be a spreader of the virus. And if for nothing else, then wanting to keep your loved ones safe, certainly continue to mask, double mask, all of that. Dr. Gibbons, right, exactly. Dr. Gibbons, can you tell us a little, so there have been concerns, a number of people have voiced concerns about the speed at which the vaccines were developed. Right now, my argument is we live in the 21st century. We should expect that certain things should be developed. World-class science should be developed, in a speedy fashion. But can you help walk us through that? Talk about the speed at which the vaccine was made. What does that matter in this conversation?
Yeah, no, I think this is really actually a testimony to advances in science. And so actually vaccines have been around for well over a century. And, many of us grew up getting vaccines. And so in some ways, there are elements of it that are kind of an old technology, if you will. But as Dr. Leeks eloquently pointed out earlier, there have been advances in terms of how we make these vaccines compared to previous iterations and what we may have even experienced as a child getting our childhood vaccinations. And a key part of that innovation was what we've developed in terms of the technologies of being able to manipulate DNA, the genetic code, in this case, of the virus itself. And we have that technology to produce all kinds of drugs really now by engineering what protein we want to create and doing it basically in a test tube. And so as Dr. Leeks pointed out, this isn't the first experience with this kind of family of viruses of coronavirus. We had the MERS and SARS before. That gave us clues about how to engineer these sort of vaccines in ways that use technologies that have now matured in a way that could be mobilized. So almost as soon as the sequence of this new virus of SARS-CoV-2 was made available in December of 19, literally within a couple of months, the teams were working to develop vaccines against it. So that's where a lot of the quote unquote speed comes. But there were no shortcuts. There were no steps skipped in terms of being sure that it was either both safe and effective. It still went through the various stages of testing to make sure that when it trained the immune system, that the body responded with a robust response to those antibodies that fight the virus and neutralize it and get it out of the body. And then, as we pointed out, tens of thousands have been studied over the course of the year. That took a lot of mobilization of those trials. Indeed, at NIH, we were monitoring and have been, and still are, monitoring each of those trials and tracking the data to see, okay, how effective is it compared to just getting sort of salt water, if you will. And that's where we could see dramatic differences. So this is unequivocal about how effective these agents are. And as was pointed out, studying safety. But again, streamlining the process such that we were already gearing up to produce the virus as we were testing it. We were going to hold off until we really had the data that was safe and effective, but that didn't stop them from learning how to manufacture and make as much as possible. That's also shortened the time necessary to produce as much. Now, it's not as fast as in producing 1 billion doses as we need and would like in the first several months. But again, even that's pretty remarkable. These are not easy things to manufacture and produce. And yet we're sitting here literally within a year of even knowing this virus existed, and we've already vaccinated millions of people around the world. That's incredible. But again, without shortcuts, and never curtailing or compromising safety or efficacy.
This is such a big issue, and I imagine it takes a while for people to really wrap their hands around the grandeur of this whole thing. This is huge. I mean, we're still in a state of being where we're recovering from the shock of 2020, you know, in terms of all the things that COVID has caused. And I know Dr. Tokars is not on the call to help us talk through some of the behavioral health related issues, some of the mental health issues. I'm wondering though, if anyone would like to speak to this idea of returning to a new normal, or what it, you know, where we are as a people, feel free to mention that. That's not a question, it's more just, you know, I open the floor to speak to that.
Yeah, well, I guess I would just throw out that unfortunately the number of overdoses, the number of suicides, that's also going on. When I said the life expectancy for Black people went down, and this is something by 3 years, that's not something that typically happens in epidemiology. So the devastation is widespread, and its impact, and clearly there are elements of the isolation, the stress, and particularly again in communities of color, in the context of literally again an economic depression, recession that has compounded. It's almost a perfect storm of elements that have been brought together, and so clearly there are implications. I'll also just mention that there are effects of this virus that we're still learning about in terms of not only affecting your lungs and your breathing and causing a pneumonia, attacking your heart system, attacking your blood system, but there's a fair amount of data that the brain and your neurological system is affected. And we may get into it further in our dialogue, but even recovering from this stressor of this disease, many of your audience may be aware of something called long haulers or long COVID. It takes a while to actually recover. So even though the virus is gone, it's had an impact on your body and on your psyche that can have long-term effects. And those also need to be addressed. I'll pause there.
No, I want to just pile on, Gary, to kind of what you're saying. The other thing that so one, if people say, well, if I get COVID, it's mild and I'll be okay. But there's a reason that college sports and the NBA and others, you know, either created bubbles or stopped games when their athletes were experiencing an outbreak. They've seen the echocardiograms, the heart studies that show that there's decreased muscle function when someone's infected with COVID. So they didn't want to end up with a bunch of athletes who had some kind of what we call kind of myocarditis, is what doctors say, but let's say heart inflammation that decreases heart function. We don't want to end up with a bunch of folks like that because we don't know where that's going to go. And like Gary said, we don't quite understand a lot of the long-term impacts. I heard numbers as high as 40% at one point, but I'm sure that Dr. Gibbons and those guys at the NIH are going to be commissioning long-term studies, prospective studies, so we can follow people, monitor their heart over time so we can get true numbers on that. The other thing I want to say that we're going to run out of time to talk about, guys, but I did interact. I didn't have anyone in my family die from COVID, but I knew a lot of people who did. And I knew a lot of well-to-do people, lawyers, doctors. I'm not talking about, everybody was impacted by this. Here's a story that I heard. Her cousin, early on in the COVID-19 kind of disaster, let's say within the late first quarter, she called the ambulance. She was having trouble breathing. The ambulance went to her house and said, you got COVID. We ain't putting you in an ambulance. Wow. And that woman stayed at home and she died. Okay. She died. People were going to the ER and they were turned away because of whatever reason. I'm going to call it a little bit of implicit bias. Like that's how racism works. When folks are turned away, you can go to Henry Ford in Detroit and you can see some of the stories there that were published about African-American people going home and dying after they were sent home. So I feel like, you know, guys, we're here now. You got 3 African-American docs on the phone. You got like a Mia who's leading kind of a national effort on these conversations. God, you can believe us, right? We've all had the vaccine. The vaccine is safe. We're telling you that the best of science is there, but there's a real ugly side of this, guys, that I would like to see our community kind of come through, shake away some of the sort of crazy things you guys are hearing, because I get some of the crazy things. My family talks to me too, and they watch a certain TV station that says a lot of crazy things. I say, guys, why are you watching that? Like, watch this, right? So I just want to point that out, that this has been crazy, like for our community. There's been implicit bias. We've been turned away. That drug that President Trump got, that antibody cocktail that he got that made him sort of get well faster than most would, most of us didn't have access to that, okay? And we're still not going to have access to it. So I want you to stay well. The vaccine is our pathway to do that.
Thank you for that. I know we're coming up against the last couple of minutes. I'm wondering, you know, I will say this, because you touched on something really important, Dr. Gibbons, in terms of the isolation part, you know, in terms of people, in terms of suicide increasing, and we'd already seen an uptick prior to 2020 for other reasons, you know, but I'd be remiss if I didn't mention that the Congresswoman herself, her colleague, who Representative Jamie Raskin, who represents parts of Maryland. He was the co-manager of the impeachment trials, as you know. He lost a son in December of 2020 to suicide. And I don't know the family's relationship with COVID, but Professor Raskin, he was a professor prior to becoming a member of Congress. He would be described as well-to-do, middle-class white family, and they absolutely felt the impact of the suicide related to, you know, battling depression during a period when we've been very socially isolated. And so, I hate to pause on such a heavy issue. That's a heavy issue. The racial bias is a heavy issue. These are things that our nation is just really grappling with, and the consciousness of the nation is really being challenged in these times. And you know, we don't have to live a particular existence to know and understand the depth of the pain, but we have to hear it. And this is why situations and forums like this are so very important, where we may not be living the same life, but we're all being impacted in very deep ways by the tragedy that, you know, multiple tragedies that COVID-19 has brought on. We have 2 minutes left in the conversation. This is a big question. This is almost an unfair question, but I'm gonna give it to you anyway. You know, what is the lesson of COVID-19 so far? What is the takeaway?
How dependent we are on each other. As you said, it's in isolation that we die. But we all are in this together, and we need to mask for each other. We need to get the vaccine for each other. That's the only way, as Cheryl was saying, we're going to get back to church and fellowship with each other. And that's part of our resilience. That's what part of the resilience of this community for hundreds of years. So we need each other.
I agree as well. It's advocacy. We've seen people become more, let's just say, politically aware, healthcare associated awareness. We've seen groups out there giving out masks. We've seen them educating. We've seen them, you know, try to find the places for COVID testing. We've seen them help seniors get groceries and so forth. I think that sometimes it's in the trials that we endure that we find our strength. And hoping that we really, you know, come through this, that we really continue to educate, that we help support each other as we get vaccinated, continue to socially distance and wear masks, and be really just cognizant that if we, you know, continue to employ these things, hopefully we will see better days to come.
And then finally, I agree with your comments, and I'm going to go a slightly different direction. That the lesson of COVID-19 in 2020 for me was the amazing power of knowledge and the amazing power of the internet to spread false information and miseducate people, and the power that it had over people's ability, people's decision making, that people believe a lot of things that are so far out and false. It's incredible. And so I want to challenge my community to educate yourself. I say education's liberation. You know, there's a lot of good information on the internet too. Read about what viruses are. They've been around for billions of years, and them changing and moving around and finding a place where they can rest their head. We call it finding a host, but you know, they're looking for a human to engage with. That's since the beginning of time, guys. This is so the idea of a virus that moves between person to person is not new. How they move is somewhat unique, how they present. I just think that I would like for us to be very conscious, guys, about what we accept as truth or fact, and maybe read a little bit harder and deeper. And I'd like to challenge the American school system to teach more science to folks earlier. Guys, I'm a big proponent of better STEM education, because I think if we had more folks who understood what a virus was, that we wouldn't have all these things that people just make up. And I'm really, guys, amazed. I may write a book on this. The number of things I've heard attributed to COVID-19 is really, it's just really amazing. So I would like to encourage, because we're seeking information. Don't say our people aren't seeking information. We are seeking information. Let's educate ourselves about science and, bring it into our lives in ways that are positive. Thank you.
Thank you all. Dr. Gary Gibbons, the director of the National Heart, Lung, and Blood Institute at the National Institutes of Health. Thank you very much to Dr. Angel Leak, who joins us as an infectious disease specialist. Very hearty thank you to Dr. Cheryl Rucker-Whitaker, who is the CEO of Complete Care Management Partners, LLC. And in her absence, we're grateful that Dr. Amal Tokars was able to join us from the Illinois Department of Public Health. Before we go, the Congresswoman is back here with us, but I do want to just encourage you all to continue to stay abreast of the conversations and the work that the Congresswoman is doing. You can follow her on all the social medias, and she will not spew false facts at false information, to Dr. Rucker-Whitaker's point. So you can follow her on Twitter at Rep Robin Kelly. You can follow her on Instagram at the same thing, at Rep Robin Kelly, and then on Facebook, Rep Robin Kelly, her page. And then finally, you can also sign up for her monthly office newsletter if you want to learn more about what the Congresswoman and her staff are doing on behalf of her constituency. robinkelly.house.gov. Follow her there. And then otherwise, just to everyone's point, stay together, stay well, stay safe, invest in the things that bring you joy and keep you healthy. And with that, Congresswoman, the last thing that I will say, again, is what Dr. Tokars mentioned, the website from earlier. If you want to know more about where you can access the vaccine and which providers nearby are offering it in your area, you can go to coronavirus.illinois.gov /vaccine/location. So it's in the chat. You can scroll back up in the chat and find that. But Congresswoman Kelly, I'll turn it back over to you. And I thank you all for your attention and your goodwill.
Thank you so much, Mia. Thank you to the panel. I so appreciate you taking the time to share your talents, your intellect, all of your information with our viewers or Zoomers or Facebook Livers, whatever we're calling ourselves now. But thank you so much. Really, really appreciate you taking the time. And hopefully you've convinced more people to take the vaccine. So thank you so much and be safe. And yes, wear your mask. Thank you.
Thank you.
Bye.